بسم الله الرحمن
In the
الرحيم.
name of God, the most gracious, the most merciful, welcome, dear journalists, followers, and viewers, in a new WHO virtual press conference, East Mediterranean Office. This time, we will tackle the closure of the 69th session of the WHO Regional Committee for the Eastern Mediterranean resolutions and decisions taken. We are honored to have with us the following panelists: Her Excellency Dr. May Akaila, Minister of Health Palestine and head of the RC69, Dr. Ahmed Al-Mandari, WHO Regional Director for the Eastern Mediterranean, Dr. Rana Al-Hajj, Director of Program Management. And before we start, I would like to apologize for starting a bit late due to the lengthy concluding session of 69th session of the Regional Committee. This press conference will be in Arabic with simultaneous interpreting into English. Now I give the floor immediately, without further ado, to Her Excellency Dr. May Leila to give her remarks. At the outset, over to you, ma'am. Thank you very much indeed. The Regional Committee held its 69th session over a 4-day period in the premises of the regional office in Cairo, with the attendance of 22 countries of the region represented by ministers or their delegates, and also the Director General of WHO, Dr. Tedros, attended, along as other UN agencies. There were technical sessions held of great importance, tackling a number of issues of great importance to the region, be it relevant to diseases or relevant to administrative or managerial matters. We have taken proper resolutions and decisions after deliberations in respective sessions. Thank you very much indeed, Dr. May. And now over to you, Dr. Ahmed Al-Mandari. Thank you, Muna. Your, Your Excellency, Dr. May Taylor, Minister of Health of Palestine and Chair of the 69th session of the Regional Committee, brothers and sisters from the media, may peace and mercy and blessings of Allah be upon you all. We have just concluded the 69th session of the Regional Committee for the Eastern Mediterranean held between 10 and 13 October 2022. The session convened under the theme Reaching Sustainable Development Goals in the Post-COVID-19 Age, Accelerating Universal Health Coverage and Health Security, Health for All by All. The theme summarizes the urgent need to mobilize all our capacities, will, and strength to achieve the health-related SDGs, applying the lessons that we have learned during the COVID-19 pandemic. For 4 days, regional committee meetings have involved intense discussions, deliberations, exchanges of views and experiences with ministers of health, representatives of member states, partner organizations, and WHO experts, many of whom were able to attend in person for the first time in 2 years. Together, we have reviewed the health situation across the region and looked at ways to move forward in the post-COVID-19 era. We discussed the vital importance of investing in more resilient health systems, the need to prioritize preparedness for emergencies, to enhance digital health, and to take bolder steps towards ensuring equity as we adopt the One Health approach. Our discussions resulted in several resolutions that aim to translate words into concrete policies and actions on the ground. The Regional Committee expressed concern not just about progress towards the SDG targets for universal health coverage, but also over the region's vulnerability to emergencies from multiple hazards, including disease outbreaks and natural disasters. It endorsed the regional agenda set out in the paper Building Resilient Health Systems to Advance Universal Health Coverage and Ensure Health Security in the Eastern Mediterranean region, and urged member states to work on all the actions recommended in the paper, as well as to set up a high-level multi-sectoral mechanism to oversee health system resilience building. Member states were also urged to fulfill their commitments under Vision 2023 Health for All by All, to implement the cervical cancer elimination strategy, ensuring inclusivity of health access for refugees and migrants, to update regional national strategies on HIV, hepatitis, and sexually transmitted infections, and to accelerate their implementation towards achieving 2030 targets. The committee endorsed a strategic framework to coordinate and integrate support from Gavi, the Vaccine Alliance, and the Global Fund to fight AIDS, tuberculosis, and malaria, and urged member states to take all necessary steps to accelerate the prevention, control, and elimination of communicable diseases and increase domestic public funding allocation for HIV, tuberculosis, malaria, and immunization programs. We are affirming that health inequities within and between countries are politically, socially, and economically unacceptable, and mindful of the vast implications that current health, environmental, and social crises have on people's ability to take control over and improve their health. The Regional Committee issued a resolution calling on member states to strengthen health promotion and disease prevention through good governance and health system strengthening, and requested the regional director to propose a roadmap to guide member states in the implementation of the agenda to improve health and well-being in the region. Concerned that around 75% of emerging infectious diseases among humans are zoonotic in origin, and cognizant of the escalating public health risks posed by emerging and re-emerging zoonotic disease outbreaks and their pandemic potential, the Regional Committee issued a resolution to establish a regional quadripartite One Health coordination mechanism comprising high-level representation from the WHO Regional Office for the Eastern Mediterranean and regional offices of the Food and Agricultural Organization of the United Nations, the World Organization for Animal Health, and the United Nations Environment Programme to oversee and manage One Health-related activities within the region. The resolution calls on member states to boost efforts to institutionalize the One Health approach and ensure that a system is in place to govern, manage, coordinate, and oversee One Health activities and create a supportive and enabling environment for One Health, including legislation, policy, and budgetary allocations. Acknowledging that effective implementation of digital health technologies is crucial for efficient national and subnational health systems, and that such technologies offer enormous opportunities for health innovation while also posing potential risks. The Regional Committee issued a resolution endorsing a regional strategy to foster digital health. Combined, the resolutions passed by the 69th session of the Regional Committee represent a clear departure point for our work in the years to come. We will still strive towards their optimal implementation to ensure they achieve the desired results and move us towards a healthier and more sustainable future. Thank you, and may peace and mercy and blessings of Allah be upon you all. Thank you, Dr. Ahmed Manzari, and allow me to start with a question to Dr. Rana Al-Hajja. The question reads as following. One of the technical papers pinpointed the impacts of climate change. What is your recommendations for national systems to counter climate change hazards, and what is the role of WHO in countering this phenomenon, and what are diseases relevant to climate change? Questions from Hazem Badr, Middle East News, Mohammed Mandouh from Al Qahira 24, Marwa Saleh from Akhbar Al Yom portal. Over to you, ma'am. Thank you very much indeed, and thank you all colleagues. This question is rather pivotal, particularly that Egypt will host upcoming November COP27 in Sharm el-Sheikh, and Egypt. And also during our meeting this week, we had a meeting for the preparations ongoing for the COP27 in Egypt. The advice, the WHO's advice on how to counter climate change. First and foremost, every country in the region should have an accurate and precise evaluation to determine the magnitude of hazards resulting from climate change and to ascertain that all such countries have a plan in order to grapple with the impacts of climate change, a very precise and target and targeted plan. And via WHO and via all the regional offices, we deal closely and cooperate closely with our countries to pursue evaluation and to apply the health plans, particularly the necessary ones. For the epidemic diseases, there are multiple diseases that could be impacted by climate change, as we have seen. The percentage of increase in temperature in general, what they call global warming. There are many changes because of the global warming, resulting into the increase of epidemics impacted by such decisions. Even the natural disasters taking place is due to climate change. For example, the floods that we have witnessed in many countries of the region, such as changes resulting from droughts. In this region, we have the two extremes. All such matters may lead, like floods may leading to the vector-borne diseases or the mosquitoes such as malaria or like the dengue fever, and they are on the rise in the region. Even the diseases that may be transmitted via water or waterborne diseases, like all the diarrheal diseases. So climate change has large impact on health, not only with regards to epidemics, it also has impact on the respiratory diseases because pollution increases respiratory diseases, particularly people who are more susceptible or are suffering of asthma. So there are health impacts for climate change, and they are grave ones. And this is one of the priorities that we have set forth currently for WHO's strategy for the upcoming 7 years up till the year 2030. Also, we seek to enable and empower each and every country in the region in order to have access and to realize the SDGs, particularly health-related SDGs. Thank you, Dr. Rana. Now, a question is to the Minister. A question reads as following. First, we congratulate you as being elected for the chairperson of the 69th session of the Regional Committee for 1 year. What is your perspective vis-a-vis the work of the Regional Committee under your chairmanship, and how can you achieve the tasks you've been assigned to, particularly in finding a mechanism for cooperation amongst countries of the region, as well as partners to achieve the aspired objectives? Questions from مصطفى الحجاج، أخبار اليوم، أنعم العلام، يوم السابع.
جزيلا لك أخت منى، وشكرا إلى الإخوة الصحفيين والصحفيات. يعني شرفني أن أكون بدور رئاسة هذه الدورة ولمدة سنة. هذا شرف عظيم إلى فلسطين أولا ولي شخصيا ثانيا. في هذه الدورة كان هناك نقاشات كما ذكر معالي الدكتور أحمد المنظري الريجنال دايركتور، وحكى عن قديش في كان مداولات وخلصت هذه المداولات والنقاشات إلى 6 قرارات فنية و9 قرارات إجرائية. القرارات الفنية خرجت عن الأوراق الفنية المقدمة من منظمة الصحة العالمية الخبراء، وعرضت على الدورة وتم مناقشتها باستفاضة وتم تبنيها وخرجت إلى قرارات، وبالتالي أيضا سواء كانت قرارات فنية أو قرارات إجرائية. وبهذا يجب متابعة هذه القرارات سواء كانت الفنية أو الإجرائية بالتعاون مع مكتب منظمة الصحة العالمية، وأيضا من خلال مكتب منظمة الصحة العالمية سيكون هناك الاتصالات من قبل الفنيين وحسب ما ترتقي مكتب المنظمة ليزوروا البلدان بزيارات للبلدان بلدان الإقليم يعني، ومتابعة هذه القرارات التي تم اتخاذها. فسيكون هناك أكيد يعني اتصالات دائما وتنسيق دائم مع مكتب المنظمة الذي يقود هذه تطبيق القرارات ومتابعتها.
شكرا معالي الوزيرة. وأتوجه بالسؤال للدكتور أحمد المنظري. سؤال يقول: استعرضت اللجنة الإقليمية تقرير المدير الإقليمي لأعمال المنظمة خلال العام المنصرم، فما هي العوائق والتحديات التي قابلت عمل المنظمة العام الماضي، وما هي خطط العام المقبل للتغلب عليها، وهل يدخل توطين صناعة الأدوية والقضاء على فيروس سي ضمن القرارات؟ الأسئلة لأحمد سعد من الأخبار ومصطفى حجاج بوابة أخبار اليوم.
شكرا منى وشكرا أخي
بوابة
أحمد.
آخر الأنباء، أعتذر.
شكرا منى وشكرا أخي أحمد وأخي مصطفى على هذا السؤال. طبعا التحديات التي يواجهها الإقليم كما تعلمون يعني هو يتكون من 22 دولة، وللأسف 50% تقريبا أو أكثر من دول الإقليم تعاني من الأزمات ومن الطوارئ ومن مختلف يعني التحديات التي لها علاقة بالصحة وغيره من أوجه الحياة العادية للإنسان والفرد والمجتمع بأسره. كما ذكرت الدكتور رانا يعني شهر 6 تعرضت باكستان لفيضانات، وتعرضت الصومال للجفاف أدى إلى نوعا ما مجاعة في القرن الأفريقي، تعرضت أفغانستان لزلزال بداية هذا العام، فلذلك معظم دولنا تعاني من مختلف أنواع الأزمات والتحديات. إضافة إلى هذا طبعا مع الحاجة الملحة للتوفير الموارد هناك نقص في هذه الموارد بسبب التنافس العالمي على هذه الموارد سواء على المستوى الإقليمي أو على مستوى العالم أجمع بسبب الظروف التي يمر بها العالم ومختلف دوله. فهذا النقص في الموارد يعني أدى طبعا أكيد يعني بلا شك إلى أو أثر سلبا على تنفيذ هذه البرامج بمختلف أنواعها، يعني مثلا برنامج التطعيمات، برنامج الأمومة والطفولة، برنامج العناية بالمرضى الذين يعانون من مختلف الأمراض السارية وغير السارية. أدى كذلك إلى ضعف الأنظمة الصحية، إضافة إلى الهشاشة التي تعاني منها تلك الأنظمة يعني على مدى سنين طويلة بسبب الحروب والاضطرابات والقلاقل السياسية والكوارث الطبيعية. خطتنا المستقبلية بإذن الله كما هو الاتفاق يعني مع أصحاب المعالي والسعادة الوزراء أنه عمل خطة يعني استراتيجية قصيرة ومتوسطة وبعيدة المدى من أجل ضمان توفير هذه الموارد وحسن استغلالها والوقوف على الاحتياجات والتحديات على أرض الواقع والمضي قدما لتحقيق.
We're going to develop a long-term and medium-term strategic plan. Of course, this is indeed the spirit of our work, and the strategy is going to deal and address, to deal with as well as address all aspects, so that we will be able to enter this year, and we together with the countries and to share success stories, as well as we hope that we work together with teams from all systems, particularly the health systems. Thank you, RD. Dr. Rana, one of the questions says that one of the resolutions for this RC69 relates to HPV vaccination. When will this vaccine be available, and is it going to be part of the routine vaccination, and will it be available at reasonable prices, affordable prices? The question is from Mohammed Mamdouh from Cairo. Thank you, Mr. Mohammed, for this very important question. In this conference, a technical paper was presented on a regional strategy for the eradication of cervical cancer from the region. And this elimination of cervical cancer is indeed one of the key goals. The paper is mainly centered on the prevention and by the provision of the vaccination to children between 9 to 12 years of age. The 3 pillars in the strategy is, first of all, the vaccine for prevention purposes. We also have the screening, that is to say, that would enable us to have early detection of the disease in addition to treatment. These are 3 pillars for any strategy that will be adopted by any country in order to achieve the goal of the elimination of cervical cancer. Of course, we encourage all the countries of the region to introduce the HPV vaccination as part of the routine vaccination campaigns. Of course, the vaccine is available. Nonetheless, countries must take the decision, the national decision, that is to introduce that vaccine as part of the routine vaccination programs. This would require evaluation of the capacity of the country and at the same time the prevalence of the disease in the given country. Of course, these prevalence rates are important. At the same time, the affordability of this vaccine and the introduction of this vaccine into routine vaccination programs. We work in close partnership with the countries to raise their capacities technically to be able to take this decision properly and to be able to implement the 3 pillars of this strategy. We also would like to say that we have, to date, we have 4 countries that introduced this vaccine: Libya, UAE, Saudi Arabia, and Morocco, that is currently preparing for the introduction of this vaccine by the end of this month. Other countries are also working on this kind of preparation. I'd like also to mention that the cervical cancer is one of the few oncological diseases that can be prevented by a vaccine. And the other cancer is the hepatic cancer, which also has a vaccine by being committed to the routine vaccination of hepatitis B. Generally speaking, that is. However, for cervical cancer, the prevention from that type of cancer is indeed very important, and the treatment is even part of a larger policy, that is to say, the strategy for the improvement of women's health, and which includes the protection against specific cancers that are relevant to women. And this is within the view of a comprehensive initiative for the protection of women's health. Thank you. The question is to you, Excellency Minister. What are the policies taken by the Palestinian authorities to prevent the introduction of polio and cholera that appeared in some Syrian governorates? During your chairmanship of this session, will you take any special measures to avoid them from becoming endemic? Question from Al Masa paper, from Cairo 24, and from other media venues. Many thanks, Ms. Mona, and many thanks to Mr. Abdurrahman and to other colleagues. Yes, cholera is now introduced in the region. With respect to polio, we dedicated a full session to discuss polio. We've taken several decisions with respect to these 2 diseases, and particularly polio. There will be important measures to protect against the spreading of cholera and polio in general. In Palestine, polio was introduced from Israel to Palestine 3 months ago. We informed the WHO of such. We took the decision to launch vaccination campaigns for children in adjacent communities to the Israeli borders. And we will provide polio vaccination now. And then we are going to launch a nationwide polio vaccination campaign. And cholera, thankfully, we don't have incidents of cholera, enough of the cholera of the occupation. The question is to RD Ahmed Al-Manzari. What is WHO doing to launch vaccination campaigns in Pakistan and other countries? We know that Al-Azhar has taken steps in order to play a role, but with respect to raising awareness, what is the role of the WHO? The question is from the Middle East paper, and probably he's pointing to the role of the Islamic Advisory Group that is mandated with dealing with poliomyelitis. Thank you very much, and thank you, Mr. Hazem, for the question. In fact, this is a very important challenge that we face in many countries of the region, particularly, as you mentioned, in Pakistan and Afghanistan. Unfortunately, we've lost many opportunities in terms of the eradication of poliomyelitis because of these challenges. As Mona mentioned, there is a close collaboration together with the Islamic Advisory Group with the support and under the auspices of OIC, Al-Azhar, and the Islamic Academy, as well as the Islamic Development Bank, again under the umbrella of the WHO. One of the programs that are implemented periodically in this regard is supporting under the support of these four organizations in the Islamic world. First of all, we organize awareness sessions and capacity building sessions for faith-based leaders in Africa, in Asia, in Europe, as well as in the region. We also issue different awareness bulletins and outreach activities in whether through social media or again through audiovisual material and through the written reporting in order to examine the different challenges with respect to this particular topic. Any plan is also introduced. There is continuous work. Definitely, this is a major challenge. However, our hope in God is much bigger, and we hope that we will be able to eliminate this infodemic and this kind of ignorance with respect to dealing that disease and its negative impact on future generations. Thank you. Thank you, Dr. Ahmed Al-Mandari. And unfortunately, due to the limited time, we are going to suffice with these questions, and we would like to leave the remaining minutes for closing remarks from His Excellency Ardi Ahmed Al-Mandari and from Her Excellency, the Chair, Minister of Health in Palestine.
في نهاية هذا المؤتمر الصحفي.
نعم بداية أود أن أشكر.
Initially, I'd like to thank the WHO EMRO region represented by RD Excellency Dr. Ahmed Al-Mandari and Dr. Rana Al-Hajja, as well as all other programs and teams working in the office for their commendable efforts through the meetings of RC69 as well as other meetings, and providing us with updated technical instructions that are in line with the up-to-date research. And in fact, this is really a very important effort and commendable effort that is accepted in this. Very important for us to exchange opinions and ideas. We thank them for their continuous commitment to communicating with countries. We receive full support from the office. I'd like to thank you, Dr. Ahmed Al-Mandari and Dr. Rana, and I'd like to thank all the officers here, because in Palestine, we do need this technical support and we need the full support that would enable us to deal with health care in Palestine, particularly given also the difficult circumstances that we experience in Palestine. Thank you once again. Moreover, the regional office is not giving its support only to Palestine, but all to countries in the region. All the colleagues here are working around the clock in order to ensure that this region is enjoying full healthcare services, not only for the health of human beings, but also for the health of the environment, and for adopting also the One Health approach therefore, this indeed is our reference and authority for all issues on health. And thank you for them. Thank you for opening your doors for us. And thank you for listening to us attentively. Indeed, this is something that we didn't experience before. Many thanks, Dr. Ahmed. Thank you to your teams, and may you be fully rewarded. Dr. Ahmed Al-Mandari, Excellency, the floor is yours. In the name of Allah, thank you, Muna, and thank you, Excellency, Madam Minister, for this continuous support and encouragement. I have a few messages that come to mind upon the conclusion of this fruitful meeting that was held in Cairo over the past 4 days. The first message is that thankfully, this meeting was like a celebration for all of us. We were able to exchange ideas related to the promotion of the health situation in the countries in the region. This meeting and reached a joint message agreed by the experts that the region is rich in resources, not only human resources or natural resources, or even the geographical location, but it is also rich in its positive values. We enjoy a spirit of collaboration and solidarity. We enjoy also a spirit of mercifulness and equity. We collectively agreed that this richness in the region indeed makes us to strive to achieve excellence, not just to survival. Of course, we focus on all walks of life, but particularly health. And that's the message that was communicated to us by the Excellencies, Ministers of Health and delegations of health systems and regimes in the region. As the Quranic verse says it, those who help sustain one life as if they were able to help sustain the lives of all humanity. This is indeed very important, and it is the driving message and motivation for us. We will strive to achieve everything that we have agreed on over the coming year until we meet again in October, and with consultation with the Excellencies Ministers of Health in a manner that is in line with the different resources, plans and strategies, national plans and strategies, in order to save lives, in order to face up to all challenges, emergencies, as well as endemics and epidemics. So thank you once again, and we look forward to upcoming RC next year. Thank you, Dr. Ahmed Al-Mandari. Thank you, Dr. May Al-Kela, the Minister of Health in Palestine and President of the RC69. Thank you, Dr. Rana Al-Hajja. Thank you, our media colleagues, and until we meet again, stay safe. Thank you. Thanks to